Hi, I'm Dr. Adam Zuckerman, and today we're going to be showing you some knee exercises. We see a lot of chronic knee patients in our office get better, and today what we're going to do is we're going to show you stretches and strengthening exercises so you can help better yourself at home. Here to help me is one of my assistants, Janeda, and she's going to do a great job demonstrating these exercises. So first what we're going to do, we're going to show you the stretches that you need to do. You always need to stretch out first before you do any strengthening exercise. You need to get the muscles looser. So the first stretch that we're going to do is a calf stretch. So what you're going to do is you're going to go to a wall, and you're going to put your hands against the wall, and you're going to do a lunge. So you're going to bring one of your legs back, and you're going to put pressure on the ball of your foot. And then what you're going to do is you're going to bring the heel down. Bringing the heel to the floor, you will stretch out the calf muscle. One of the biggest things that people do as a mistake is that they just do a lunge and bring their foot down without starting off at the ball of their foot and bringing it down afterwards. If you just start off with a lunge and not on the ball of your foot, you will not feel the stretch and get the benefit of the calf stretch. Now, the reason why this exercise is important is because these muscles all work with the knee. They surround the knee, protect the knee, stabilize the knee, and attach to the knee. So once again, the calf stretch, you're going to reach your hands against the wall. You're going to start off on the ball of your foot, and then you're going to bring your heel down, and you will feel the stretch right in here. Okay? That's for your calf on the back of your leg. Now what we're going to do is the quadriceps stretch. Your quadriceps muscles are right in the front of your thigh. Once again, muscles that help stabilize the knee, so it's important to stretch these muscles out. So a lot of people with knee problems, you're having problems with stability. Once again, we help patients in our office with knee problems on a regular basis, and we help gain their stability and balance and stability back. But you're going to have a hard time doing this if you don't have stable knees. So what I want you to do is to be safe, grab a chair, and Janeda is going to show you how you could do this at home. You're going to hold on to the chair, and you're going to grab the back of your leg. Remember, our goal is to stretch the front of your thigh, your quadriceps muscles. You're going to be stretching right over here. So if you could show them from the side, please. Grab the back of your leg and pull up gently. Now, whenever you do these stretches, I should tell you, you never want to stretch to the point of pain. You want to go just so that you feel a nice stretch in whatever area you are stretching. You want to hold it for about 5 seconds, and then relax. Hold it for 5 seconds, and then relax. You're going to start off doing about 5 to 10 repetitions just so you can make sure that you're doing what's right for your body. Okay? Always listen to your body. The next stretch that we're going to do to help you with your knee is a hamstring stretch. We've all heard about hamstring stretches. I'm going to show you a gentle way of doing it today. So, Janeda, if you could please have a seat on the floor, maybe face sideways for people watching the video. Okay, now the key when it comes to hamstring stretches, have a seat up. The key to hamstring stretches is that I notice that when people go to stretch their hamstrings, they actually let their knees buckle, and you don't want to let that happen. So Janeda, if you could bring your legs flat to the floor, you want to keep the knees flat. It doesn't matter how far you go. We don't care if you touch your toes. I just wanted to get you to get the benefits of the stretch. Your hamstrings are in the back of your leg. So we already did your calves on the back of your leg here, your quadriceps on the front of your leg over here, and now we're going to stretch out your hamstrings. So what I would like for you to do, Janeda, is reach for your toes, okay? And make sure that your knees are down, folks. Make sure that your knees are down so you get the benefits of the stretch. Now, if you could only reach your shins like that, and you feel the stretch on the back of your thighs, right over here is where you should be feeling the stretch, right over here, that's okay. Okay? No, nobody's asking you to get to your toes. But once again, don't stretch to the point of pain. Stretch to where you feel the benefit of the stretch and hold it. Hold it for 5 seconds and then relax. If you feel pain, back up. You want to get to the point where you feel the stretch, but if it's ever painful, just back up a couple of degrees. It's fine. I want you to get the benefit of this stretch to help your knee. Okay, Janeda, if you could have a stand. The next exercise that we're going to work on, we're going to work on some strengthening exercises. So as a recap, so far we looked at some stretching. We need to loosen muscles up first. We looked at your calf muscles. We looked at your quadriceps muscles on the front of your thigh. And we also looked at the back of your leg and your hamstrings. Once you get limber enough and looser, and we restore range of motion by stretching, then it's suitable to start strengthening. I can't convey to you enough that not everybody is capable of going straight to strengthening. You have to crawl before you run, okay? When it comes to knee problems, we see patients in the office who have a little twinge in their knee, down to chronic patients who have been debilitated for 20, 30 years. They come to us and they get better, but we have to pace ourselves here. So the strengthening exercises that I'm going to show you now, you may not be able to do right away, but I do want to show you what it's going to take to strengthen your legs at home. Okay, so the first exercise we're going to work on are squats, and this is going to strengthen not just your quadriceps muscles, majority of your quadriceps muscles, but also your glute muscles and the tush and the hamstrings, which we just showed you how to stretch. So Janeda, if you could show us how to do some squats, I'm going to have you put your back against the wall. You want to put your back against the wall for stability. You want to make sure that you feel comfortable. Remember, you have knee problems, folks. You can't go all the way down to the ground. We don't want you to. So what you're going to do is keep your back against the wall and just separate your feet about shoulder width so you feel stable, okay? And bend down a little bit. Just go a couple. Janeda's a warrior. She's going very far right now. Just go down a couple degrees to start off with. You'll feel this. Why don't you show them where you feel it? In the front of your thighs, okay, in your quadriceps muscles. You're going to build up these muscles so that your knees will be stronger. These are the muscles that help support your knee, so we need to strengthen them. Now, what I also encourage you to do at home is while you do this, especially if no one's around to help you, or if you feel unstable, grab a chair. You could do these while you hold onto a chair as well, so that you don't feel like you're going to wind up on the ground, and you feel that you could get the benefit of the exercise. So once again, strengthen the quadriceps muscles, okay? The next exercise we're going to show you for strengthening are hamstring curls. We're going to strengthen your hamstrings, and if you remember before, you stretched your hamstrings when Janeda was seated on the ground, stretch the back of your legs. But now we're going to strengthen your hamstrings, okay? So what you're going to do is you're going to hold on to a chair, and you're going to curl your leg up, just like so. This is a basic starting point. Curl your leg up, hold it for 5 seconds, relax back down. And with all of these exercises, once again, stretches or strengthening, you want to hold it, relax. You'll do about 5 to 10 repetitions at first and build from there. Always ask your doctor who's treating you. You could give me a call and I could help advise you if you want a consultation. But you want to pace yourself with this as well. After you do this without any weight, excuse me, you could get some ankle weights. You could go to a local sporting goods store, get 2-pound ankle weights, 5-pound ankle weights. You have to go at your discretion, of course, based upon what you can handle. If you're fortunate enough to have a gym in your community or that you go to in your community or in your clubhouse, they also have exercises that will strengthen this region as well, okay? So once again, starting off very basic, go with your own body. And then as you progress after you're doing this for several days to a week or two, if you feel comfortable, add some weight to the ankle. Go get some ankle weights. 2 pounds start off with, okay? And you're going to work on strengthening the back of your leg. It's very important, okay? Before we showed you calf stretches, now we're going to show you calf strengthening, okay? Now to strengthen your calves, once again, grab a chair to hold on to, okay? Janeda is going to stand on one foot if you're capable of doing this, okay? So you're going to stand on one foot. And we're going to strengthen the foot that is still on the ground. You're doing this, and what Janeda could even do is she could bring the back of this foot, relax your leg, bring the back of this foot and kind of hold on to there if you're capable of. Just gives you some stability. And what you're going to do is you're going to raise up onto the ball of your foot. And if you could show people how Janeda is literally off of her heel, you're going to raise your heel up, okay? And then you're going to relax down. Okay, and once again, you're going to hold it up, you're going to relax down. You're going to do this just like every other stretch or strengthening exercise. Hold it for about 5 seconds and relax, okay? And you're going to go up and down, and that's going to help strengthen the calf. So far we've strengthened the quadriceps, the hamstrings, the calf, okay? And now the last one that we're going to do is leg extensions. This is another way of strengthening your quadriceps. So what you're going to do, Janeda, if you could please have a seat. What I'm going to have you do is raise your leg up. You can see, just like we did with the other exercises, if you raise your leg up, you're going to go with your own body weight first. Relax it back down. We're strengthening these quadriceps muscles, just like we did before with the squats. We're going to do them with leg extensions. Once again, you may even have a gym that you're capable of going to help you with this, but this is an essential exercise for building these muscles up. Once again, raise up and back down. So after you do this for several days to a week or two, depending on the individual, then you could go to the local sporting goods store, get 2-pound weight, 5-pound weight, put it around the ankle, and add some resistance there to really build these muscles up. Chronic knee conditions are a horrible problem. We see a lot of patients coming in getting better. We have patients that have been suffering for decades, even after they've had surgery. So the stretches and the strengthening exercises that I showed you will help you stabilize that knee. It'll help you increase your range of motion. It'll help increase the musculature and the support to give you a strong knee. If I could ever be of any assistance, you could always give me a call. I hope you learned a lot today, and I hope that your condition gets better, and I look forward to hearing from you. Take care.